Maayong adlaw everyone! Welcome to CORRdapya TV. If you're new to my channel, my name is Cor and I'm your business nurse from Southeast England. Care home nurses like us have to be very critical on conducting assessments on the elderly in order to arrive at a single goal, which is appropriate intervention. This may mean preserving the life of a resident or service user during an emergency incident or situation, or to prevent unnecessary injury or even death. In today's vlog, I will be sharing to you the most common emergency scenarios in a care home. But disclaimers first, this list is not exhaustive and is only limited to my experience in a care home setting. So top of my list of the most common emergency scenarios in the care home is falls. So this can be categorized into three. It's either a witness fall, unwitnessed, or assisted falls. So there are several reasons why a resident will have a fall. So some of the common factors that can trigger a fall are first, medications. So if the resident is taking any antihypertensive medications or if they are on sedatives. Second, if the resident has mobility issues. Third, if the resident is confused or unfamiliar with their surroundings. Fourth, if the resident has a seizure or epileptic attack. Fifth, if the resident has an ongoing infection or suspected of dehydration. So your interventions for this kind of emergency scenario will totally depend on the falls protocol in place in your care home. The falls protocol may vary between England, Northern Ireland, Scotland, and Wales. So here in England, we are following the NICE guidelines or National Institute for Health and Care Excellence. So these guidelines are providing recommendations of treatment and care here in England and Wales. So what are you going to do if a resident has a fall? So let's say, for example, if a resident is found on the floor, your immediate action is to ring the emergency alarm and wait for the team to arrive. So once the team is complete, so it's either composed of all the nurses on duty, or the nurses plus the deputy manager or plus the manager, or the senior carers plus the nurses. So whoever is available to attend to the emergency situation. So the team will help each other in checking the resident for any injuries such as wound, bruises, lacerations, any signs of fracture, bleeding, or to check if the resident is in pain, because this will determine whether the team has to phone the ambulance or not. So the interventions of the team will depend if the resident has no apparent injury, has minor injury, or if a resident has sustained serious or major injury. If the resident has no apparent injury, the team has to assist the resident to a comfortable and safe position. So if the resident is still able to mobilize without any discomfort or pain, the staff can offer assistance when transferring or can use a transferring machine like hoist. After the resident is positioned comfortably, the nurse has to take the observations or the vital signs of the resident and observe for the next 24 hours. Aside from that, the nurse has to complete the post-falls assessment, notify the GP and the relatives of the resident, and do the documentation such as completing an incident report and updating the risk assessments and the care plans of the resident. If the resident sustained a minor injury such as bruises, minor wounds, and discomfort, you have to add these actions. So you have to do the first aid such as wound dressings or giving analgesics, and you have to complete a body map. So those are the actions that you will add on top of the basic interventions that you will do in case of any falls. If a resident has a major or serious injury such as airway and breathing problems, unresponsiveness, acute confusion, potential head injury for those residents taking blood thinning medications or anticoagulants such as warfarin, apixaban, and dabigatran, if the resident is in pain in the chest and in the limbs, if there is bleeding or extensive bruising, or if the resident is unable to follow commands. The team must not move the resident and immediately phone 999 to seek for ambulance. The responsible staff has to inform the resident's relatives and complete the documentation. So if you will ask me how many times did I encounter falls in the care home, I'm telling you, I can't even recall how many. Multiple times. And I think the most challenging part is when you're assisting residents who are severely confused, and combative. There was one instance when I was helping my colleague transferring the resident who had a fall. She slapped me so hard that I blacked out for 2 seconds. Imagine. The key to reduce the number of falls in a care home is the proper risk assessment and having the preventive measures in place. Another most common emergency situation in a care home is when a resident is having a stroke or heart attack. The key to this situation is to promptly recognize the symptoms of heart attack and stroke. So for an elderly having a heart attack, they usually have chest pain, lightheadedness or dizziness, shortness of breath, and overwhelming anxiety. To recognize if the elderly has a stroke, they are usually using a validating tool called FAST, F for face, A for arms, S for speech, and T for time. So in using this validating tool called FAST, you may notice that the face has dropped on one side, or the resident is not able to smile, or if the mouth or the eye has dropped. As for the arms, the elderly might not able to lift both arms or there is numbness. And for the S or speech, there can be slurring of speech. And T is for time. That is the time for you to dial or phone 999. While waiting for the paramedics, you have to stay with the resident. So even though that the resident has been attended by the paramedics because you have notified them because of the stroke, it doesn't necessarily mean that the resident is going to the hospital for treatment or further management, because it will still depend on their RESPECT form. RESPECT form stands for Recommended Summary Plan for Emergency Care and Treatment. So this document provides a summary of recommendations to help the healthcare professionals in making immediate decisions about the person's care and treatment. So if the document says that the resident does not want to be hospitalized even in the event of stroke, then the healthcare professionals must respect that decision. Another factor that the healthcare professionals have to consider is when the resident is on end-of-life care or palliative care. So your interventions when the resident is not going for hospitalization is to maintain the comfort and safety of the resident, do the vital signs, administer any prescribed medications, notify the GP, inform the relatives, and do your complete documentation. Another emergency scenario in a care home that you will encounter is when a resident is bleeding heavily. Bleeding can be caused by 3 factors. The first one is through traumatic injuries such as wounds. Second one is due to medical conditions like blood cancer, cervical or lung cancer, or if the resident is suffering from low platelet count. And the last one is due to medications such as anticoagulants or blood thinning medications. Some of the common situations that you will encounter are a resident having nosebleed or epistaxis, any catheter-related trauma or injury, or when a resident has sustained an open wound due to a fall, or a resident passing out stool with blood or vomiting out blood. When the bleeding is not resolved by first aid or when the bleeding is excessive, that's the time you have to phone 999. Similar to the other emergency scenarios that I have mentioned earlier, your responsibility as a nurse is to maintain the comfort and the safety of the resident, do the vital signs, notify the GP, the family, and complete your documentation. Based on my experience, I've encountered residents who suffered from nose bleeding, and mainly it was caused by change of weather or temperature, but this was easily resolved by doing the ice compress. There was also an instance when I encountered heavy bleeding from the catheter as the resident pulled his catheter due to severe agitation. So that's the time when I phoned 999 due to excessive bleeding. The fourth most common emergency scenario in a care home is when a resident lost consciousness or turned unresponsive. Some of the reasons why the resident becomes unresponsive are when the resident is doing vasovagus training, when the resident's blood sugar or the blood pressure is low, or when the resident is having a seizure episode. So obviously, you have to address the reasons why the resident is unresponsive. So for example, if the resident is having this vasovagus training, it's probably because the resident is constipated. So you have to administer if the resident has a prescribed laxative. And if the constipation is not resolved, that's the time you have to refer the resident to the GP for another prescription. As for the resident's blood sugar level, you have to do your diabetic management for that. Then as for hypotension or low blood pressure, You can address this problem by elevating the legs of the resident to promote circulation, and you can also encourage hydration and rest for the resident. And if it doesn't improve, then that's the time you have to notify the GP, and for emergency situations, then you can phone 999. The last condition that causes a resident to be unresponsive is having seizures. So that will be our fifth emergency scenario that you will encounter in the care home. So one of your residents has a seizure attack. So these are the following interventions for you to do if the resident has a seizure episode. First, you can move the resident if you feel that they are in danger. Second, cushion the head. Third, loosen the tight clothing. Number 4, stay with the resident until they recover. Number 5, position the resident to sides, or what we call the recovery position. Number 6, note the time of the start and the end of the seizure episode. Number 7, administer medication if there's any. Number 8, notify GP and the relatives of the resident. And number 9, complete your documentation. You have to remember not to put anything in the mouth when a person is having seizure. Seizures are considered emergency for the following reasons. Number 1, if it's the first time for the person to have a seizure. Second, if the seizure lasts for more than 5 minutes or more than the usual duration of a seizure of that resident. Number 3 reason is if prolonged confusion remains after 10 to 15 minutes after the seizure. Number 4, when there is trouble of breathing after the seizure has stopped. And number 5, when the person has become unresponsive. And the last reason that we can consider that the seizure is an emergency situation is when the person sustained serious injuries during or after the seizure episode. So far in my experience here in the UK, I have encountered one resident who had an absent seizure attack. The resident recovered, hence there is no need for us to phone 999 at that time. Instead, we have notified the GP about the resident and informed her family. So we have to bear in mind that elderly people can have atypical presentations due to their number of coexisting health problems. Therefore, it is difficult for us to diagnose these emergency conditions. Our actions as a nurse in a care home must always be guided by protocols in place in our care home and in relevance to the residents' advance directives or respect form, with clear and agreed treatment plans which include the do not resuscitate orders. So we have to be very careful with our interventions. So just a quick recap. So our 5 most common emergency scenarios that we can encounter in the care home are: number 1, falls. Number 2, stroke or heart attack. 3 is bleeding. Number 4, loss of consciousness or unresponsiveness. And 5, seizures. Okay? So I hope you have learned something from this vlog today. If you find this valuable, please give it a thumbs up or share this video. If you have not subscribed yet, please subscribe to my channel to see more contents like this. Thank you once again for watching and for spending your time with me today. I'll see you soon. Bye-bye!